There are certain ways that your body tells you that your ovary is releasing egg. In today's video, I'm going to be telling you the signs and symptoms of ovulation. I am Dr. Amarachi Ijeoma. I am a fertility physician, and my channel focuses on everything in fertility and women's health. So if you want more content like this, click the subscribe button below, like this video, share with your friends, and keep watching. Number one is the calculation method. I've done a previous video on how to calculate your ovulation. I'll attach the link above so you can click to watch. But in summary, what I talked about is that knowing your cycle length is key. How do you know your cycle length? By checking for the first day you see your period blood, you count that as your day one till the last day before you see your next period. That is your cycle length. It is the number of days in between your period. So if you have a 28-day cycle, just subtract 14 from it. It will be remaining 14, meaning that your ovulation should be on day 14. Will be most likely on day 14 because also this is not exactly accurate. So it will most likely be on day 14. Then you have an idea that you should be ovulating around this period. If you have a 30-day cycle, it's the same thing. Just subtract 14 days from the 30 days. It will give you day 16, to give you 16. And then it means that you should be ovulating on your day 16, around the period of your day 16. Another way to check is your resting temperature. When you're trying to conceive, you can check your body's temperature every morning, first thing when you wake up. That's what we call the resting temperature. So the morning that you check your temperature and it has increased by 0.5 degrees Celsius or 1 degree Celsius, then you have most likely ovulated. But if you check it one morning and it has increased more than 1 degree Celsius, then please go and see your doctor. That's no longer ovulation. That's most likely fever. So please go and get evaluated and see your doctor. So when your vaginal discharge becomes plenty, transparent white, and then it's very stretchy, like you can take it with your finger, this middle finger and your thumb, pick it and then stretch it like this. When it stretches, it is a symptom that you have ovulated. The idea of the stretchy, thin nature of your cervical mucus, of your vaginal discharge at this point is to make it easier for the sperm to swim, to go and fertilize the egg. Our bodies are really special. Another thing you can check for is tender breast. It doesn't happen with everybody. So it doesn't mean that if you don't have tender breast, then you're not ovulating. No. But for some people, they experience tender breasts. Some other women complain that they feel bloated. That is, they feel like their belly is filled with gas, like they are too full. You know, they feel slightly uncomfortable, like there's gas in their tummy. That's what we call bloatedness. So this is also another sign of ovulation. Like I said, it doesn't happen with everybody. It happens with some women. Lower abdominal cramp. Some women complain of lower abdominal cramp during ovulation. This also doesn't happen with every woman. It is called Mittelschmerz. It's a German word that I've never been able to pronounce properly. And frankly, I don't really care. But you get the idea. Lower abdominal cramp. Some studies say that it's as a result of, when the ovary releases the egg is swimming in a collapsed tube. So the friction with which the egg is traversing the tube is the pain that you feel. So like I said, there's no conclusion to this, but this is the theory, or one of the theories. All these signs that I have mentioned don't always mean that you are ovulating. It is not accurate. It's not like because you've seen these signs, therefore your ovary has released an egg. These are just signs that give you an idea that you have ovulated. For some people, yes, it means they have ovulated, but sometimes it doesn't always mean that. So what causes these signs? As a result of hormonal changes in your body, the estrogen and progesterone. So throughout your menstrual cycle, you have these hormones that are acting at different phases of your menstrual cycle. So during the first half of your menstrual cycle, your ovaries releases the hormone called estrogen. When this estrogen gets high enough in the body, it causes the biggest follicle to rupture, meaning that it causes the biggest sac with fluid, the biggest sac that contains water, and inside that water there's an egg suspended inside it. It causes that sac to burst, to rupture, and release an egg into your fallopian tube, waiting for a sperm to come and fertilize it. So when that sac collapses, it will now cause another hormone to rise, the progesterone. So a combination of the estrogen and the progesterone leads to the symptoms that I have mentioned earlier in this video, like increase in temperature, feeling of bloatedness, like there's gas in your belly, increase in your body temperature, your resting body temperature, change in your vaginal discharge. Not all follicles contain eggs. That is, not all sacs with water, not all sacs with the fluid contain egg. Sometimes when this sac ruptures, when this sac bursts, there's no egg that comes out of it. But then you will still have some of these symptoms because of the hormones that are involved in your menstrual cycle. So there are other ways to know that you're ovulating. One, over-the-counter ovulation prediction kits. This means that you can just walk into a pharmacy close to you or a chemist and ask them for ovulation kits. So you can just buy it without prescription, and then you take this ovulation kit, go home and test to see if you're ovulating. How do you test? So it's a urine test. It usually tests for a hormone that goes up 24 to 36 hours before your ovulation. This hormone is called the luteinizing hormone. It's usually highest in your fertile window. So this test usually has enough test strips for you to do it multiple times during your cycle. So you want to start testing a few days to when you feel that you're likely to ovulate and a few days after. Another method is ultrasound scan. This method involves several trips to the hospital. The scan shows the follicles, that's the sacs of fluid. And with each successive visit, with each visit to your doctor, you will be able to appreciate the growth of your follicle or follicles, that's of the sacs, on an ultrasound scan machine. You will be able to see the leading follicle, that is the biggest follicle. The day you do the scan and you don't see that follicle anymore, it means the follicle has ruptured and ovulation has taken place. Ultrasound scan has a higher accuracy than all the other symptoms and methods of checking your ovulation that I have mentioned in today's video, but still it is not 100% accurate. The only 100% way of knowing that you have ovulated is pregnancy, because pregnancy cannot occur without the release of an egg. I hope you found today's video informative, and if you want more videos like this, subscribe to my channel, like this video, and see you in my next video.